She was my world. She my best friend and obviously the love of my life and the mother to our children.
Beauty influencer and mom of two Jessica Petway died at the age of 36 from cervical cancer after initially being
Hello?
Hi, Nicole. How are you?
Good, how are you?
I'm good. I'm good. You ready?
I think so.
I know you
As
are.
as ready as I'm ever gonna be, I guess.
You got this. How do you want me to introduce you? Do you want me to introduce you as Veronica Fox, Nicole Fox, Veronica Nicole Fox?
You can just introduce me as Nicole Fox.
Okay. All right. Um, let's just double check in your, have your bio here. Do you want to make me a co-host? That way, if people are talking or anything,
Yes.
mute.
Now, how will I do that? Let's see. Okay. Make co-host. That was easy. That's probably the easiest thing I've done today. I just had a panic moment. I tested my video over and over again last night at my house on a separate device, and it was playing. And I realized today that it wasn't playing sound, but I figured that out. I just had a little panic moment.
Gotcha.
And
When
so hopefully
you did share screen, did you click the little boxes in the corner?
yes, I did that. That's what I figured I wasn't doing at first.
Gotcha.
So I was only listening to the sound on the one device. So you guys have had a busy couple of days with all of these presentations. Are they back to back for you?
Yeah, so Dr. Pittman and I try not to get onto too many unless because we're troubleshooting on the backside. Like we had
True.
somebody who had Zoom link issues. That's happened a couple of times. We had somebody who at the last minute had to pull out from introducing. So at one point I was introducing someone on my computer and then I had my phone over here and I muted and went to my phone and introduced somebody else. I was like, we just get creative to problem solve. That's what social workers do, right?
Yes, that's what we do.
So, but yeah, it's gone really well. You know, there's always something at this size, you're always going to have some type of glitches. But you know, overall, it's gone really, really well.
I hope this one is no different. And I'm not sure how many people will be joining. I have a few people from my job that wanted to sit in on it, and of course, my family. And so now I'm like, oh, I think it would have been better if it was just me and Dr. ER.
You know, I've seen a range. I've seen as small as maybe 5. And then I was talking to Dr. Loeffler, who I don't know, she did Carol Taylor's presentation, and she said Carol
Mhm.
had 61. And that's what I've seen in places where you'll have a small group and then you'll have huge group.
Yeah.
So it all varies. Looks like you
Well,
got
I'm
2
not
in the
expecting
waiting
61, but
room. Yeah. Have you been able to get to see anybody else's presentation?
so yesterday I think I did watch 4 presentations yesterday. This morning, I needed to not
Yeah,
watch any others just for
for
my
your own
sanity.
self-care, yes.
Yeah. Because yesterday I was like, that's a good idea. I should add this and I should do this. And I couldn't do that this morning, but I have
Yeah,
2 more scheduled this afternoon. And then tomorrow I'm going to watch all of the ones that I can.
gotcha. Good,
Yeah, they've
good,
been pretty good. They've been,
good.
really good. People are passionate about their topics. And I just like hearing, what other people selected because, the program, there's so many of us. There's some students I've never interacted with before
Right, right.
and don't, had no idea what their topics were, but
Yeah, yes.
it's a wide range.
Especially when you're not in the same concentration. I mean, there's some students that unless they've come to my drop-in sessions, because I don't teach in the clinical track, that
Okay.
if I didn't have them their first year, which this past year I didn't teach any first year courses, um, I will have never had them in class. So I wouldn't know them unless they came to a drop-in session with me.
Oh, yeah.
That's always interesting.
Yeah, I've had my phones on do not disturb for about 24 hours. Like it's so anxiety provoking.
Do you have a preference of, would you like me to keep my camera on? Because a lot of people will turn theirs off. Do you want me to keep it on so you have somebody to look at? Do you want me to keep it off? It doesn't matter to
Um,
me.
it's whatever you want. I'm actually going to minimize all the cameras so I'm not looking
Okay.
at anyone. I don't even want to look
Okay.
at myself.
Okay.
So
All right.
yeah, so it's whatever you prefer, but it doesn't matter to me.
Okay. Sure.
Yeah.
I'll probably
It
end up
looks like
turning it
people
off
are.
because sometimes I have to answer texts in between.
Yeah, no, I completely understand. So do you get started right at on the dot or do you give people time
I
to
try
join?
to.
Okay.
So like, if you want to go ahead and start letting people in, and
Okay.
then at
Yep.
1 o'clock we'll get going.
Hello, AJ and Don. Thanks for joining.
We have a couple minutes before 1, so we'll plan to get started right at 1.
So Dr. ER, will you be able to admit people as I'm speaking?
Yes, ma'am.
Okay,
I will
thank
take
you.
care of that. Good afternoon, everybody. Welcome and thank you for joining us this afternoon. I'm Dr. Laura Escobar Ratliff, and I'm the DSW Program Director, and I have the great honor of introducing Nicole Fox. Before we get started, I do just want to remind folks to please make sure that you mute your microphone. That way there's no background noise while Nicole's presenting. And then I just want to take a few minutes to share a little bit about Nicole. So Nicole Fox is a licensed social worker with over 25 years of experience in healthcare, mental health, and public health settings. She is currently a family services coordinator at a top-performing organ procurement organization, working to save lives through organ and tissue donation. She is a doctoral student at the University of Kentucky, focusing on health equity and how social workers can impact change related to racism. Ms. Fox is dedicated to advancing social work through education and research, empowering the next generation of social workers to make a positive impact in marginalized communities. She holds a bachelor's of social work from Wichita State University and a master's of social work from Newman University. Today, Ms. Fox is presenting her capstone entitled Whispers of Revolution: Cultivating Anti-Racist Advocacy Skills in Undergraduate Social Work Students. Thank you for being here today. Ms. Fox, I'll turn it over to you.
All right. Thank you, Dr. ER, for that introduction. And thank you all for joining me this afternoon. Just want to make sure everyone can hear me okay and can see the slides. I must admit, I'm a little bit nervous and excited to share my work with you. Like many students, when I started this program, I had an idea of what I wanted to research. However, over the course of the first few semesters, my ideas evolved, and then they became broader, and then I just scrapped what I was working on and switched ideas altogether. So if you know me, you know that I love to research and play detective. So all this reading in the program really sent me down a rabbit hole before I settled on a topic. Overall, my goal is to do meaningful work that advances the social work profession. So I hope you guys find this presentation helpful and are able to take away something that will be meaningful in your social work practice. So as you can see from the agenda, we have a lot to cover today. If you have questions, feel free to put them in the chat. It will be monitored, and then we should have time for questions and answers at the end of the presentation. I'm going to issue a trigger warning. Seems like everything these days comes with a trigger warning, and this presentation is no different. While the presentation is entitled Whispers of a Revolution, some of the research and the data presented are far from whispers. The statistics are loud, the history is loud, and it should make everyone uncomfortable. So uncomfortable that you leave this presentation ready to impact change. The word whisper suggests a movement that grows quietly beneath the surface, like a simmering fire yet to erupt into a full blaze. It's not a thunderous roar revolution, but rather the subtle yearning for change. For me, whispers symbolize the collective consciousness of those who have long been overlooked, the marginalized, the poor, the disenfranchised. I was drawn to this word whisper because generally I'm never the loudest person in the room, but I always want to be impactful. In this presentation, I just want to present a revolutionary way to teach anti-racist advocacy. So in April of 2023, the CDC declared racism a public health threat in the United States. So I'm going to start with a couple of videos that illustrate this problem.
She was my world. She my best friend, and obviously the love of my life and the mother to our children. One of the issues I guess I have with the system overall is, Crystal was 40 and she's Black, and we'd had a loss before. But even then, they say, you can't start a plan with maternal fetal medicine or the high risk maternity doctors until you get to week 14. And so they're like, we have to get Charlotte out of there because you're not trending very well. And now it's about saving you, Mama, not just Charlotte. And so we asked, like, is there a way that you can try to get Charlotte out in a way that we can hold her? Because that means a lot to hold your baby, even if they're passed on. And they said they'll try it. She would want everything to shine and sparkle, and she would want her laughter to be spread. So while, obviously this is terrible and tragic, and, I don't think she wanted to be the person to champion these causes, but if she was going to do it, she was going to do it with joy.
Beauty influencer and mom of two, Jessica Petway, died at the age of 36 from cervical cancer after initially being misdiagnosed with fibroids. My name's Joel, the medical mythbuster, and there's a lot to dive in here to talk about with racial disparities in healthcare. In the United States, Black women are the racial group most likely to die from cervical cancer. And recent studies show that rates of cervical cancer are on the rise for young people. In Jessica's case, her symptoms were ignored, leading to a misdiagnosis. In an Instagram post before she passed, she describes how in 2022, she was having intense vaginal bleeding. She ended up being found unconscious by her husband and was rushed to the hospital, where she was told that she was having blood loss because of fibroids. She was discharged the next day. A year later, she was taken to the hospital for the same thing, and she was told that she was having bleeding once again from her fibroids. It took multiple visits until a doctor finally looked at her cervix and sent her to an oncologist. As she says in her post, it turns out it was not a fibroid, but cancer. I was misdiagnosed all this time. This tragic story is an example of the difficulties that Black patients face. It's an example of anchoring bias when we look at a diagnosis and we get stuck with it. To the patients watching this, advocate for yourselves. That means getting your HPV vaccine. It's the most safe and effective way to prevent the types of HPV that lead to cervical cancer. Start getting your Pap test at 21 to test for cancer. And to the healthcare professionals out there, I hope you remember this story. Listen to women, especially Black women, when they say something doesn't feel normal for them. Jessica's voice may not be here anymore, but her story has to serve as a powerful reminder for the work that needs to be done in medicine.
Okay, so some of these stories in this video may seem like a one-off. Patients of other races can be misdiagnosed or be the victim of medical mishaps. Well, the research shows that African American women are 3 times more likely to die from pregnancy-related causes than white women. The infant mortality rate among African Americans is twice as high as that of white infants. 1 in 3 Black Americans report experiencing racism while dealing with the healthcare system. Racism, both structural and interpersonal, is a fundamental cause of health inequities and health disparities and disease. In some ways, overt racism in the US has been eradicated. However, it's been recreated with structural, systemic, and institutional racism and bias. There has been this narrative created that Black people have disposed are inherently predisposed to pre-existing conditions. But many of these pre-existing conditions are the result of inadequate or ineffective treatment in the healthcare system. So my research is aimed to investigate how social workers might effectively improve health disparities. This study examined the necessary knowledge, abilities, and resources that social workers must possess to effectively advocate for their patients to eliminate health disparities. So let's look at the learning objectives. Like I said, the overarching goal of this project was to use education and advocacy as a tool to help shift the narrative in healthcare for Black people. I won't spend this presentation by giving you guys a history lesson, but it's essential to understand the history. And that means acknowledging how racism and white supremacy has created conditions of chronic stress for Black Americans, thereby creating pre-existing conditions that lead to poor health outcomes. So let's sit with that for a minute. The research shows that the physiological stress of being Black in America places a burden on your body. And the result is hypertension, diabetes, and kidney disease caused by physiological stress. So by the end of this presentation, you should have an increased awareness of the understanding of systemic racism and its impact on health disparities, have an enhanced knowledge and understanding of advocacy strategies and the integration into practice, acquire an understanding of anti-oppressive theories and instructional approaches for advocating anti-racism and social justice, and then also have a comprehension of the integrated framework that I propose. So let's talk about racism. When we talk about racism, when we use this term, we need to be specific about what we mean. So I'm just going to quickly review some of the different types of racism, because often these terms are used interchangeably or are just used as a blanket statement. When I refer to anti-Black racism, that's talking about the prejudice, discrimination, and systemic oppression specifically targeted towards individuals of African descent. This can manifest in various ways, such as racial profiling, unequal treatment, stereotypes, and institutional barriers. Environmental racism, this term is used a lot in public health, and it refers to the disproportionate impact of environmental hazards on people of color. Think of things like the Flint, Michigan water crisis, where the city of Flint, which is predominantly Black, switched to a new water source that was contaminated with lead. This resulted in a number of health problems for residents, including increased lead poisoning for children. Interpersonal racism refers to the individual acts of discrimination and prejudice against people of color. This can be things like racial slurs, jokes, or other forms of verbal or physical abuse. Structural racism or sorry about that. Getting ahead of myself. Structural racism are the systemic ways in which racism is embedded in institutions and policies in society. It's not just about individual prejudice, but rather the larger systems that create and perpetuate systems of inequality. And then systemic racism and structural, those are often get confused, but systemic refers to how the overarching systems and structures create and maintain the racial hierarchies. And the last one we'll talk about is implicit bias. You guys may be all familiar with this one. It refers to the unconscious bias that we all have, refers to stereotypes and prejudices that we uphold subconsciously. Think of like a tendency for us to associate certain professions with certain genders, like all teachers may be women, nurses may be women, and we think of mechanics and truck drivers as men. But in healthcare, it has a different impact. There are studies that show that Black patients are less likely to receive pain medication than white patients for the same level of pain. And this is because some healthcare providers may subconsciously associate Black people with being less sensitive to pain. Implicit bias can lead to misdiagnosis and mistreatment in healthcare because providers may make assumptions about a patient's condition based on their race or other characteristics. So these terms are just found throughout the literature regarding racism in healthcare. So I thought it was important that we have some foundational knowledge about that. And then next we'll talk about the social determinants of health. Those are the non-medical factors that influence health outcomes. And this term is also used throughout the literature. Excuse me. These are the conditions in which people are born, grow, work, live, age that shape the conditions of their daily life. Social determinants of health also contribute widely to health disparities. For example, people who don't have access to grocery stores with healthy food are less likely to have good nutrition, which raises their risk of health conditions such as heart disease, diabetes, and obesity. So just think about maybe in lower income areas where they don't have, regular grocery stores. They don't have the Dillons, the Albertsons, Trader Joe's, or Whole Foods, but you see a Dollar General or a convenience store. The food selection that are offered there tend to be prepackaged foods that are unhealthy foods and not the healthier fruits and vegetables. Racism has a big impact on social determinants of health, which leads to disparities. The disparities include access to health care, education, economic stability, and they all affect the health outcomes. All right, so we're going to pause for just a second. I know I just covered a lot of information and a lot of terminology rather quickly, but I don't want us to lose sight of the goal. It will all come back to the goal of teaching social workers how to effectively impact change through learning anti-racist advocacy. And I haven't been checking the chat box. I tried during the video and it kept pausing it. So Dr. ER, you can let me know if there's any questions in the chat bar.
I will. So far, you're good.
Okay, thank you. All right, so now on to the capstone. This is what I've been working on. It consists of 3 products, my systematic literature review, the conceptual paper, and the practice application paper. So now that we have a little bit of a foundation about the social determinants of health, types of racism, and some basic concepts, we're gonna review the capstone components. And I started by exploring 3 research questions. I was led to this research after having experience working in public health and learning about the health disparities in my community, as well as from my experience in working in healthcare and seeing clients that were personally impacted by racism, and also from my personal experience being discriminated against in the healthcare setting. For those of you who've experienced discrimination in healthcare, think about the first time it happened to you, or at least the first time you realized it was happening to you. My first time was 27 years ago. I was in the hospital giving birth to my daughter. I overheard a conversation between 2 nurses and my OB doc standing outside of my room. The nurse had prepared my discharge papers. So this was years ago, before electronic medical records. And she was trying to get the doctor to sign the discharge papers. And the doctor said he did not place an order for me to be discharged. He had recommended that I stay for an additional 24 to 48 hours. I'd had some complications in the pregnancy, so that was his recommendation. But the nurse was adamant that I needed to be discharged because Medicaid was only going to pay for 24 hours post delivery. Excuse me. My doctor advocated for me as a patient, stating that insurance does not dictate his plan of care. But when he walked away, the nurses proceeded to discuss how I was just another young Black welfare mom who was getting free health care and going to raise my child on the state's dime. In reality, none of the above was true. I had private commercial insurance and I wasn't on welfare and had never used state benefits. But had that been the case, had I been the patient she described, would I have deserved a lower level of care than, say, a married insured mom? What was that saying about me? Like, what about me told her that I was a welfare recipient? I was a college student, 6 months away from receiving my bachelor's degree in social work. That was 27 years ago, and that just kind of stuck with me. As a social worker, I just wonder, like, how can I impact change? Am I equipped with the skills and knowledge to impact change? And if not, what skills do I need? So in social work, we often talk about advocacy. It's a fundamental aspect of the profession, advocating for the rights and well-beings of individuals, communities, and marginalized population. Advocating by speaking up, raising awareness, and promoting social justice. But I wanted to take it a little bit further by advocating for anti-racist health practices in healthcare, and specifically how we can teach those skills to new students. So my question, can integrating advocacy skills training into social work curriculum facilitate anti-racist principles in healthcare practices? That's a mouthful. So again, this is a learning process. And I learned that I needed to streamline my words and be a little less wordy in my research questions. For the conceptual paper, the research questions explored how the theoretical frameworks of intersectionality theory and critical race theory can be applied to an anti-racist teaching pedagogy to conceptualize and educate on anti-racism. And then for the last component, which is the practice application paper, the research question is how can anti-racist advocacy skills be effectively taught to social workers to facilitate the adoption of anti-racist healthcare practices? So this is a conceptual map. This is one of the ones that was developed in the infancy stages of this project. I know it's maybe a little small and hard to read, so I'll give you a second to look at it. This was developed after I completed the systematic literature review and had some ideas on the direction I wanted to go, but they weren't fully developed, and I hadn't reviewed all of the literature to determine if my concepts were needed or if they were going to be effective. All right, so we'll talk about the systematic literature review, which is product number 1. So the literature that I reviewed examined studies exploring cultural competency, cultural safety, and racism within the field of nursing, education, and social work practice. This review offered insights into the methodologies and obstacles and outcomes associated with integrating anti-racist training and education in both educational and professional settings. And I combined the data from several studies. I explored existing research on anti-racist advocacy, education for college students, and for professionals, and its impact on African Americans' broader racial health disparities. So the search strategy, I met with the University of Kentucky librarian a couple of times to maximize my search. We identified a gap in literature. We used about 8 key terms, and these are the databases that we search for articles and the inclusion criteria. And so the identification of the strategies we use the PRISMA, which stands for Preferred Reporting Items for Systematic Reviews and Meta-Analysis. So it's a tool to use to help in the identification and screening of literature reviews. So as you can see at the top, my initial search yielded 86 articles. Then I was able to narrow it down to about 17 after I removed articles that weren't peer reviewed, that weren't published in the last 10 years, and that weren't full text articles. Then of those 17, I reviewed all of the abstracts and excluded a few more that just weren't relevant to this study. And then one was eliminated because it wasn't a full article. It was more of a critical reflection page. So in total, I ended up having 4 articles for my systematic review. And so some of the key findings of the literature review are on this slide. The key findings show that when university instructors are educated about unconscious racial bias, it does positively impact their understanding of race and prejudice and their motivation to address race-related issues in the classroom. I found that new frameworks must address the fundamental cause of the health disparities and should be identified in textbooks, position statements, and accreditation requirements for universities. And then to serve equitably, new frameworks must reflect the diversity of the population in the curriculum. And that it should be noted again that this was based on four articles. So the generalizability of these findings is constrained just due to the small sample size. However, it's worth noting that the results could be reasonably applied to healthcare settings in general and student populations, but beyond social work. So the conclusions from the literature review are that social workers possess the potential to exert a substantial influence on health disparities through their advocacy efforts for equitable healthcare access and addressing underlying causes of social determinants of health. And that colleges and universities must have the capacity to equip these social work students with the necessary skills to tackle the health inequality. And this could be achieved by integrating the curriculum, encompassing social justice, cultural competency, and healthcare policy. So these findings suggested that there exists an opportunity for the integration of critical race theory into the curriculum and training modules for social work with an aim of addressing instances of anti-Black racism, which led me to explore the theoretical frameworks that I selected for my conceptual paper. So product 2 was the conceptual paper. So the objective of this paper was to develop a conceptual framework for educating social work students in the area of advocacy. The method is I used the conceptual framework that incorporated critical race theory, intersectionality theory, and critical pedagogy to provide a holistic understanding of systemic oppression and how anti-racist educational practices can address it. I also integrated the social work advocacy model. So those are the 4 parts of the theoretical framework. The background on this is that schools of social work are responsible for educating students on social inequity. And that needs to be a part of a comprehensive curriculum. So each of these concepts here on this slide could be, or theories could be their own 1-hour Zoom training. So there'll be some specific resources at the end if you want to learn more, but I will do a broad overview of each of them. Critical race theory, I know everyone's heard about it. It's been in the media relatively recently. It emerged in the 1970s, early 80s, as a framework for understanding and challenging systemic racism. It was originated from legal scholars and activists who sought to examine how race intersects with law and power and social structure. CRT recognizes, that race is socially constructed and that our perspectives shape how we understand the world. CRT emphasizes storytelling and lived experiences as a valid source of knowledge. And it seeks to understand and challenge the ways in which racism intersects with other forms of oppression. And then we'll talk a little bit about intersectionality theory. This was also coined by Kimberly Crenshaw. I don't think I mentioned her on the previous screen, but she worked with both intersectionality theory and critical race theory. And intersectionality theory applied the emergence of the theory to map out the intersections between gender and race. Um, and she's an African American woman within the legal system, and the theory has kind of evolved from her. And I'll show a short video from Kimberly speaking of this in her own words.
Intersectionality is just a metaphor for understanding the ways that multiple forms of inequality or disadvantage sometimes compound themselves, and they create obstacles that often are not understood within conventional ways of thinking about anti-racism or feminism or whatever social justice advocacy structures we have. Intersectionality isn't so much a grand theory, it's a prism for understanding certain kinds of problems. African American girls are 6 times more likely to be suspended than white girls. That's probably a race and a gender problem. It's not just a race problem, it's not just a gender problem. So I encourage people to think about how the convergence of race stereotypes or gender stereotypes might actually play out in the classroom, between teachers and students, between students and other students, between students and administrators, and commit themselves to understanding that as a way of intervening and providing equal educational opportunity for all students, regardless of their identities. Identity isn't simply a self-contained unit. It is a relationship between people in history, people in communities, people in institutions. So schools do a good job when they understand that and when they commit themselves to curricular development, to opportunities in the school for all students to understand the histories that have brought us to this particular moment. You can't change outcomes without understanding how they've come about. So independent schools can take the lead on that to be responsive to their student populations and to the communities out of which the students come.
So I like how she said, you can't change outcomes without understanding how they come about. And this slide here just shows the principles, aims, and approaches of critical pedagogy. Pedagogy refers to the study of teaching and the methods used to educate students. So this encompasses theories, strategies, and practices that teachers use to facilitate learning and promote the development of students. Critical pedagogy can be incorporated into anti-racist teaching because it encourages critical thinking, questioning the power dynamics, and promotes social justice in the classroom. It involves creating a safe space for students to explore, challenge systemic oppression, and it also fosters a sense of agency and empowerment. And then the last piece of the framework is the social work advocacy model. So this was developed in the early 20th century, but it doesn't have a specific founder that it's attributed to. It's been developed and shaped by numerous social work scholars, and it just recognizes the importance of addressing systemic issues and advocating for change. The key features include identifying issues, raising awareness, and promoting policy changes. So this is the conceptual framework that I came up with. By integrating the 4 frameworks that we just talked about, we can create an anti-racist advocacy education model that challenges the root cause of racism and other forms of oppression, empowers individuals to critically examine their own beliefs and assumptions, and encourages you to take action to create a more just and equitable society. And this is another conceptual map that was developed later on in the process. I know it's probably a little difficult to read because it's pretty busy, but this is the second iteration of the map. Just a map that I used as a roadmap for this project. It served as my visual thought process as I was working through the project. Recommendations from the conceptual paper are that social work programs can amplify the voices of marginalized groups and promote the advocacy model by placing emphasis on the integration of diverse perspectives and lived experiences in the curriculum. And this model has the potential to cultivate enhanced collaboration and critical reflection among students and the communities that they engage in or engage with. So the third product of this capstone was the practical application paper. Since 2020, over 260 US cities, counties, public health agencies, and academic institutions have declared racism a public health crisis and have committed resources to dismantle the systems that have reinforced health inequity, replacing them with more equitable policies, practices, and allocation of resources. So this paper analyzed the necessity of including social work advocacy as a skill to promote the development of anti-racist practices in healthcare. So could this be a tool? Could developing a system to teach anti-racism to social workers be a tool to help dismantle the system? The analysis used for the practical application paper were the same: the critical race theory, the intersectionality theory, and the critical pedagogy. The rationale for function. So again, rationale for focus. Again, we're talking about health disparities that result from racism. So did you know that at birth, Black people have a shorter life expectancy compared to white people? African Americans are 3 times more likely to die, or more likely to have a chance of getting COVID. Infants born to women of color are at a higher risk for infant mortality compared to those of white women. So amidst the persistent epidemic, escalated racism, and political instability, there exists a unique opportunity for social work educators to guide aspiring professionals toward affecting substantial change. And that was discussed in the practical application paper. I continued to review the literature, and I found that there's continued evidence of antiquated formal teaching approaches that fail to properly address how professional and educational materials continue to perpetuate white supremacy through embedded language. And these are present at schools of social work and universities across the nation. There's a gap in service. Social workers contribute to the perpetuation of detrimental social systems by endorsing policies that continue to oppress Black, Brown, and Indigenous people. There's a failure to engage with oppressed communities, a failure to engage with those communities that are experiencing daily obstacles due to systemic barriers. That's frequent in social work practice. So we're providing services as social workers, but we're not making genuine connections with the desire to help alleviate the oppression. So social work has a history of being charitable, the altruistic desire to help people. Let's help those poor Black people. Let's help those poor people, but not really. Not help them enough so they're treated as equal, but let's just help them. So we want to do more. I want to do more. I want it to be different. And there's a growing body of literature that shows that Black women are becoming increasingly vocal in advocating for healthcare on an individual and a community level. But despite their efforts, they continue to be unheard or have their concerns ignored when seeking medical attention, especially in regard to neonatal and maternal mortality. Reports indicate that new social work graduates face challenges in addressing race and speaking up against racism. When they wanted to speak up, they were unsure of how, what their role was, and they weren't confident in their abilities. All right, so talked a lot. In the chat, I want to hear from you. When you hear the word advocacy, what does that mean to you?
Someone put in providing
Providing
support. Can you see it? Can you see it?
Yeah, no, thank you,
Okay.
Dr. ER. Yeah,
Sure.
thank you for that. So advocacy is an action. Advocacy in social work entails actively promoting and providing support for the rights and welfare of individuals, groups, and communities. Anti-racist advocacy signifies an individual's behavior that attempts to reduce racism embedded in individuals and institutions. See, amplifying the voice and needs of others. Thank you, Stephanie. Representing for the needs of a group. Thank you, Janelle. So there are many different ways social workers can be advocates. Anti-racist advocacy, community, legislative, policy, individual, and systemic. Typical undergraduate BSW education is focused on a micro level. Micro level advocacy involves working directly with individuals and communities to address their needs and raise awareness and empower them to advocate for themselves. Many master's level social workers spend little time engaging in advocacy activity and focus more on clinical practice or professional as a profession, or leading social workers to pay less attention to advocacy activity in the community. So for the social workers on the call, think back to your undergraduate education. Maybe it was 5 years ago, 10 years ago, or like me, over 25 years ago. What type of education did you receive in advocacy? How did you learn to be an effective advocate? Did you ever have an opportunity to practice these skills in the classroom or in a field placement? I think it's important that undergraduate social workers get the education and the exposure to all of these types of advocacy, and get an opportunity in practice settings and practicum settings to demonstrate their knowledge of these types of advocacy. So my recommendation out of all of these 3 Capstone products, my recommendation I proposed based on my research was development of a CSWE curricular resource. CSWE, we'll talk about a little bit more. It's the accrediting body that presents education for social workers. And their EPOS has a curricular guide series that serves as a supplemental guide to programs and educators on relevant topics in social work. So social work professors and professionals can go and pull from this volume of literature and pull activities to do in the classroom, to use in the classroom. Each resource is produced by a task force of national content experts, and users can select from and access the suggested resources on each of the 9 competencies. The resources include full descriptions of in-class exercises and activities, and this resource guide that I'm proposing is designed so that the lesson and modules can be integrated into several courses in the course catalog, so that students have an opportunity to receive this information multiple times over the course of study. Ideally, the curricular resource will be used in practicum classes, social work policy classes, and practice classes, but it can be used throughout the curriculum. The curriculum aims to cultivate students' understanding of advocacy and provide them with the knowledge and skills to address social justice issues. And this includes opportunities to be placed in field practice settings as an undergraduate that expose them to legislative advocacy and policy advocacy, which are typically reserved more for graduate students. This includes collaboration opportunities with community partners for community-based advocacy and partnerships with local government for systemic advocacy opportunities. This resource just solely focuses on teaching anti-racist advocacy skills. So racism is pervasive, and it's not just in healthcare. So these skills are applicable to any social worker in any setting. So the curricular resource, they are shorter than the actual EPOS curricular guides, but the curricular resource that I'm proposing is specialized content that may be used as a supplement in the classroom or practice. I did not attach a curricular resource to this included in this presentation, but if you scan the QR code, it will take you to a link that provides a sample of the curriculum that I propose. And again, briefly, just for those who may not be aware, CSWE is the Council on Social Work Education. It's a national association representing social work education in the US, has more than 800 members of bachelor and master's level social work programs, and their affiliated instructors, students, and staff, as well as practitioners and agencies that are dedicated to advancing quality social work. And they have standards, and the standards that this curriculum resource addresses is standard 2.0.1, engage in diversity in practice, and then also that the program engages in specific and continuous efforts with the implicit curriculum related to anti-racism, diversity, equity, and inclusion. And this also addresses the NASW, the National Association of Social Workers, ethical standard regarding social workers should fight against social injustice and seek social change to improve the well-being of historically marginalized people. So, in conclusion, wrapping it up for you, I think we still have a little bit of time for Q&A. Social work educators are instrumental in the formation of competent social work advocates. It's my opinion that the use of this conceptual framework and the curricular resource presented can be used as a tool to strategically and methodically equip new generations of social workers to challenge systems and institutions and individuals that participate in the system of oppression. The model empowers social work students and instructors to be critical as they examine their own beliefs and assumptions, and encourages individuals to take action. So you might ask, is this revolutionary? I say yes. I mean, I believe it's revolutionary because I want to challenge traditional perspectives on race and power by promoting a more inclusive and equitable society. Think about your social work education. Think about how much has changed since you got your degree. Have you met this new generation of kids? Have you met Gen Z? This generation was born to challenge the system. They are using technology and social media to raise awareness and build community. We can't educate them or motivate them or empower them with the same outdated teaching methods that we learned from. So my question to you, do you want to be revolutionary? So many of you on this call are not social work educators, but you're ready to be revolutionary. What should you do? You can educate yourself, check in and acknowledge your own biases and privilege. Be a voice. Don't be afraid to speak up. Don't be afraid to speak to your clients and ask them about their experiences and how you can best serve them. Get a mentor. Be a mentor. You can use your phone to scan this link, and actually all of the QR codes are the same. They will take you to a sample of the curricular resource guide, and they will also take you to resources and then a reference list for this presentation. So thank you all for taking time out of your schedules to attend this presentation. I hope it was informative. I've included my contact information on the slide, so please reach out to me if you want additional information or you want to collaborate on research in the future. And I think we have some time for some questions. I'll check the chat, and I think I can unmute everyone. Let's see.
Nicole, you have some comments and a couple of questions. Can you see them, or do you want me to read those to you?
You can read them. I'm going to try and unmute
Okay.
everyone.
So, comment from AJ to your question about training. It can help social workers be more confident in speaking out when they feel an injustice is being perpetrated. And then M. Dempsey said, I feel this work should be introduced in all professions, not just limited to the field of social work. I would like to see this work published through the education system. Please consider continuing this research, introducing it to all. Absolutely. And then M. Dempsey had a question for you. How has the research outcome changed the way you practice in the field of social work?
That's a good question, Midge. So just the work that I do daily, it's always evolving and it changes the way that I practice. It just makes me be more aware and start with my client, my patient, whoever I'm working with, and get their perspective. It causes me to make less assumptions and be more curious, ask more questions.
So the rest of the comments were just answering your question about advocacy and such. So I would invite folks, if you have a question for Nicole, to unmute yourself and ask your question or drop it in the chat, and I'm happy to read it out for you.
Thank you for that comment, Jesse.
I have a question, if no one else is going to pop up with one. I'm just curious, as you did your research and worked on putting this guide together, was there anything that didn't surprise you, that surprised you? Sorry, I said that wrong. Was there anything that surprised you?
What surprised me most, it was the gap in the literature that I couldn't find a lot out there. Although we have these standards from the competencies from CSWE and from NASW that say as social workers, we should be doing this work, I didn't find a ton of evidence that we were actively doing the work, that we were actively making policy changes or procedure changes within universities and within governments. That was probably the most surprising.
And so maybe you might have
go
addressed
ahead.
this. Hi, good morning. Great job on your presentation. You may have addressed this and I may have missed it, but I was wondering, what do you think in your area of practice, in your spaces, what have been some of the, in your personal experiences that you mentioned earlier, at the post-delivery of your baby? What do you think has been some of the issues or barriers to actually doing this work? You know, I say that because I remember the push and the controversy of the EPUS changing in 22 and all of the labor that kind of went into that and the back and forth. But just in general, in practice though, what do you think are some of the barriers that you may have witnessed to actually being committed to doing the work and then continuing, you know, adjusting and reassessing as we move forward?
Thank you, Dr. Webb, for that question. And I think I saw you on Lucretia's presentation yesterday. So I definitely feel like you're a person I want to connect with after this presentation. For me, one of the biggest barriers is I live in Kansas. I work in Kansas. We're not the most advanced state. So I think it's a lot of lip service and little action in my state. You know, they will check the box, and that's about as far as it goes.
That is a very abrupt response. I
Sorry.
hear that. You know, because you're absolutely right. And I have, as you mentioned, so many personal experiences within the healthcare space, in primary care. And I remember talking with my doctor. This is probably about 10 years ago. And by her being Caucasian, one of the things I said to her, I said, it's already hard to trust being African American, and I'm also Yoruba, but being a person of color is somewhat hard to trust doctors. And this is some of the reasons why, right? And she understood that. She took time to listen to that. But then a few years later, I asked for a specific test, and she refused to give it to me. She was like, "No, I'm not going to, do this." And I said, "Well, why? I'm asking for this. That's going to be covered. No problem with that." And she said, "Well, I don't think you are one of the persons that belongs to a particular group that would need this particular procedure." And I said, "Well, you don't respectfully know what I may do when I leave here in the afternoon, or what I do on my primary job or not. If I'm asking for something, I believe I should be able to get it, especially if it's covered." And she just kind of looked at me. She didn't know what to say. She didn't know what to do, except for apologize. And and she said, "Well, I realized that my own preconceptions or pre-notions about some spaces within my practice, I want to apologize for that." She realized she had offended me, but it was already, kind of too late in that regard. But I just wonder how many persons of color, women of color, especially young women who go to the doctor, those who have passed the young past 16, and they go into to the doctor's primary care, yearly checkups, those types of things, and maybe not as familiar about what to ask for, what to do, and maybe not getting complete coverage, care, medical care, things of that nature, just because they're afraid to ask questions, or they're not really sure about certain things, and how many doctors really or nurses really do not understand that difference, that barrier that's there.
Right. And I've had a similar experience with my own primary care doctor here within the past, since I've been in this program. He's been my doctor for over 10 years now, has a great bedside manner. He's aware that I'm in the program. So when I'm there for my visits, he'll ask me about school, ask me about my research. And so when I talk to him about health disparities, he seemed shocked, like almost as though that's not something he'd heard of. And he was like, no, no, they have high blood pressure because they're genetically different, that Black people are genetically different. And that's what contributes to the high blood pressure. And even, said that he had just recently acquired a practice from another retiring physician, an African American physician. And he was like, all of his patients just have high blood pressure and diabetes. I just don't understand it. He said, what do you guys eat? I mean, me and every other Black patient, like we eat the same thing. And so I left there thinking, I need to get a new doctor. Like I need to get a new doctor. I just couldn't believe that, that this, well-seasoned professional doctor, just was unaware of racial health disparities and just still had these antiquated beliefs.
Wow. Nicole, I'd like to add that this is a wonderful presentation, and I'm thankful that you invited me to kick in on it. I really enjoyed it. I'm a long-time Master's of Social Work graduate also, and I have not really linked into being an active social worker. I graduated in 2009, but never really received a job working closely one-on-one with a disparity, as such as we were talking about today. But during the time when I was doing my practicum, I had the opportunity to work in the domestic violence, women leaving their homes with their children, and, just the empowerment and being able to encourage them that they can move on with their lives and they don't have to stop, they can continue moving on. I really found inspiration in that in myself, because I was a single parent, and just me, being able to encourage someone else, that was also encouraging myself. And then I was also hearing you speak about when you were pregnant. I was pregnant, and I was like you yourself. I worked, and the treatment that I received. I was over there at the Medical Art Towers building, and because of the close proximity of where I worked at in the hospital, it was convenient for me to go down in the area where they did, mostly care for women that were low income. But I was one of those that also carried health insurance, but I felt like I was treated like I did not have insurance. And that,
Right.
that really kind of affected me. And that's really what encouraged me to go ahead and get my master's of social work degree, because I seen how people were being treated because their lack of. And I thought that that was so wrong. But I really, really enjoyed your presentation. Thank you so
Thank
much
you.
for all the wonderful information that make me want to get back out there and get busy again. I'm 63 years old now, but I know that the work is great out there in our community here in Wichita, Kansas. I know that there's lots of people that are going through different challenges that they are facing during these times. But me working so closely with my sorority, and your mom, we do a lot of outreaches and helping different ones like the Wichita Crisis Center, helping women, again, that have left their homes with little or nothing, and us being able to carry needs into them to help them to be able to get started and empower them to go on with their lives with their children and do the best that they can do. I mean, that's, to me, that's a good, wonderful thing to be able to encourage somebody else.
Yes, thank you for sharing, and thank you for your work in the community. And yeah, we can connect. I'm sure we can figure out other ways to continue to serve.
Thank you. Let me know, let your mom know we can do something maybe, in our organization that can be able to be a blessing to somebody else.
I will. And then in closing, if there's no more questions or comments, I just have a brief closing.
Nicole, if I could just give you one more comment before you do
Yeah,
the closing.
definitely.
And so, yes, I know I'm not allowed to give you any more homework, but I'm gonna give you some scholarly suggestions. I love what you've done. I think what you have done is absolutely revolutionary and it's absolutely needed. Just something that you could consider is what you've done for social work education. You could even adapt for other helping professions. Like I'm thinking about your doctor. And although I think it's absolutely ludicrous that he could look at you with a straight face and say, what health disparities? That's just, I'm trying to look who's on here. I'll go ahead and say that's just asinine at this stage in life that somebody could state that, but clearly somebody can. And so you might even consider doing some adaptations to what you've created for the medical community, for for medical programs. I know that there's another student in our program doing something similar with the School of Medicine in his community, not about this particular topic, but about his topic. And that would be a way to help folks that normally aren't challenged to look beyond their myopic lens to look at other factors impacting health and wellness for marginalized communities, in particular for Black communities. So just a suggestion, not that you want more homework, but a suggestion.
Thank you, Dr. ER. All right, so I've joked that this degree has been fueled by DoorDash and Diet Pepsi, but I cannot end this presentation without saying a few words. Ooh, and I feel like I'm gonna cry already, of acknowledgement and dedication. The pictures you see here, it's my family. I couldn't have done this without them. My children, Jasmine and Isaiah, my bonus children, Zion, Braden, Zariah, Seven, and Idalia. Everything I do it for you. I hope that I make you proud.
That's beautiful.
To my son, Isaiah, thank you for sharing your senior year of high school with me. I know my cap and gown is a little bit fancier than yours, but I'm equally proud of your accomplishments
so
as you head to college. Thank you, Isaiah, for being my academic advisor and warning me of the pitfalls of Chat, GPT, and AI detectors. There are no shortcuts taken over here. Jasmine, you inspired me to follow my dreams and complete this degree as I watched you breeze through nursing school effortlessly. You both have proven that when you set a goal and put your mind to it, there's nothing you can't do. And you've been an example for me. For my parents, thank you for your unwavering support. There's never been a time in my life where you have doubted me or discouraged me from following my dreams. For my mother, you planted this seed in me over 40 years ago. It may have taken 40 years, but I did it. Chelsea, my boyfriend, my partner, my friend, thank you for pushing me to even apply for this program when I doubted myself. For your words of wisdom, delayed but not denied. Rejection is just redirection. Thank you for believing in me. Thank you for picking up the slack and carrying the load when things got too heavy for me over the past few years. To my siblings, Shantae, Janelle, Lamont, they always have my back. I have never doubted how proud they are of me. Thanks for your prayers, your support, and even a stiff drink when I needed it. Thank you. My conversation circle, Dustin, Mickey, Tammy, Lucretia, my cohort members, the group me, the UK group me. When you guys said no doc left behind 2 years ago, you meant it. Thank you for all of the encouragement and assistance and the friendships. For my Midwest Transplant Network people, thank you for joining today. Thank you for the support and encouragement. Midge, my Midge, she's like a sister, a mentor, and a prayer warrior all rolled into one. She's always encouraged me to write a book. Well, this is the first 5 chapters, Midge, and you will be included on the dedication. And finally, to my sister-in-law, Carrie, she died in the first semester of this program. One of our last conversations was her encouraging me to follow my dreams. She always encouraged me to write. She's always cheered me on, and I know she's cheering me on right now. I'm planning the menu for my graduation celebration, baking graduation cookies. Thank you.
Congratulations, Dr. Fox. Very proud of you. Thank you, everybody, for joining us today.
Thank you.
Congratulations to Nikki.
Thank you.
Congratulations, Dr. Fox.
Congratulations.
Congratulations.
Congratulations,
Thanks,
Dr.
Mitch.
Fox.
Yeah, I
So
guess I could call
proud of you.
it.
Thank you guys so much. If Dr. Webb Robinson is still on the line, I'd love to connect with you and get your contact information.
I sent it to you already in direct message,
Okay, perfect. Thank you so much.
along with an additional note.
Perfect. Thank you.
Congratulations, Dr. Fox.
All right. All right. You guys have a good evening or afternoon.
You too.
Let's see.
Trying to get
All right, y'all still on there. I'm about to hang up now. I was
trying to figure it out.
Thank you.
I'm trying to figure it out how to get out of here. Hang it up, girl.
I don't know how to get my direct message.
Dude, what's wrong with you? I got stuck in. Get some bucks tonight.